Wonderful. So hello, everyone, and welcome to Voices in Health and Wellness, where we spotlight the change makers redefining patient care, clinic operations, and practitioner wellbeing across the UK, Europe, and the US. Today, I'm very excited to be joined by Jake Behrens, the CEO and Medical Director of Envision ADHD, a clinic that's pioneering telepsychiatry model specifically designed for busy professionals with ADHD. With a background in psychiatry and a deep understanding of executive burnout and focused challenges, Jake brings both clinical insight and operational savvy to the conversation. So we'll be diving into a topic that's close to home for many in our field: why smart practitioners struggle with work-life balance. Jake has lived both sides of this as a physician and a business leader, and I think his perspective is going to be really resonate with a lot of our listeners. So Jake, thank you very much for joining our call today. Where are you calling from, by the way?
I'm in Wisconsin, in the United States. So,
wonderful. Okay. So this is a truly global podcast. We're meeting leaders from around the world. But yeah, thank you very much for joining us. Perhaps we could start by, Jake, telling us a little bit about your role at Envision ADHD and actually how you came about starting this clinic, because it is quite a niche setup, and I'm very interested to know how it all kind of came about.
For sure. And so this all comes out of, going back in residency and training. And in psychiatry, became more and more interested in the kind of adult ADHD space. And it came from working with a lot of successful, high-functioning people in the Madison, Wisconsin area when at the university there. And actually a lot of project managers, actually Epic, the big health records company, is in our backyard. So a lot of project managers, high-functioning people out of college coming in, either transitioning care or first time really struggling and wanting to be seen more for ADHD. This is going back, 15 years ago. I liked building out tools, outcome tracking tools, looking at data with people. And it was really this population that really loved, taking forms on iPads, looking at their data, tracking it, rating scales and whatnot. And that's what got me into ADHD in this particular population. We saw massive reductions of rating scales. They liked looking at their data. I liked it because I could really kind of fine tune different types of treatments with them and see some pretty robust changes. And it was also a clinical niche that at least other people in my department really didn't like working with, especially in the adult space. And for me, it was like waving a white flag saying, please give me more evaluations, more people to work with in this space. Identified a lot with the group, liked working with them. And I ended up staying on as faculty. And that was my niche that I liked working with, was adults with ADHD. And over the years, started to see just a lot of how, my whole goal is I want to fine tune treatment, and I want people to be more productive, but I want their focus to be on their work, on the work, life, home, relationships, all that fun stuff, less on the day-to-day of how do they keep up with their prescriptions, which I saw was a big bottleneck for many people, especially when project managers travel, 3-4 days a week. They're only in town. Many of these people are only in town on Fridays during business hours. And that's when they're their busiest days on campus doing their meetings. And yet once a month, they had to beg the supervisors to get time off to drive downtown to see me in person or to pick up a darn piece of paper during business hours, prescription, and drive it to a pharmacy. And this is not helping them. This is taking them away from exactly the things I want them to improve on. And that's where I started literally envisioning, okay, how would I want to get care? What is possible? I was seeing more and more people going towards my chart was the Epic, the patient portal type thing for messaging and wanting things to be done asynchronously through there. I had to keep up with messages at all times for refills, for updates. And I started to see envisioning how would I want to get care? Can I create a system that is done more easier scheduling, with online scheduling, easier messaging, things done remotely, getting into telemedicine, getting into electronic prescribing of controlled substances, which was just coming out around that time. Can I do more robust evaluations up front? A lot of the tools that I was getting into and helping to create for other institutions when I was doing a lot of health tech consulting, I couldn't use them in my own practice. I knew it was available, and I was thinking, okay, can I create a different type of model specifically for this patient population I felt wasn't met well in the typical fee-for-service? Wait 6 months for an appointment, maybe, you can get in and wait, weeks to hear back about anything or get refills. And I was following the direct primary care models that were starting to emerge around that time, kind of a per member per month, all inclusive. And I was thinking, is this a model that might fit in here? Because people need something every single month. I thought I was crazy trying to, envisioning this. Is it possible? But I got into looking at software, what type of products are available. I can do this relatively inexpensively, following more of a lean model, startup, start small, start cheap, fail fast, fail often. And that's where Envision came from. Built that out, left my job. This is one of the most difficult things to do, to move to Milwaukee because of non-compete, start up in a very small office space that I had a flexible lease on, and just to validate, can this model work of really being there for your patients, all inclusive. I would say message anytime, schedule anytime, wide open, so I can be there with people to help fine tune dosing and hopefully help make it as convenient as possible, while also being able to do more thorough evaluations, closer outcome tracking, setting people up with their own blood pressure cuffs from home, getting into electronic prescribing and whatnot. So to me, it was always like, I want to build my little baby. My clinic is my laboratory where I get to bring in new technologies, new ways to interface with people, and iterate very quickly. I'm very impatient when it comes to technology advances, and I felt so stuck in a large institution where I feel like new ideas kind of go to committees to die and get burned out. I needed a place where I could innovate very quickly, and that's where it came from. That was 10 years ago now, and now have been building out and adjusting as I go in true evolutionary process.
So amazing innovation. So what would the patient journey look like to let people listening? How would it look in terms of how the patient goes through the process? I
know myself, once again, in all of this, you kind of like know your clientele, know your niche, and if you want to go after it. And I always say my niche were my high functioning consultants and anything from myself. And I know some of my biggest things in healthcare that had always bothered me was, and still is, the lack of, especially here in the US, very, very different in the UK, but in our country, really no consistency. Every person we work with has a different set of rules, regulations based on their insurance and how it works. And there's no transparency. So everyone has different rules, restrictions, whatever. And then there's no transparency, and most people don't know the price of anything until they receive said service. Then they get a bill in the mail, which to me really bothers me. So I wanted a type of practice where people can see exactly on a website, see transparent pricing, how it works, exactly what's included, click to schedule, see available times, do this all on your own. So I know myself, even for a haircut, I'm sorry, if I can't just walk in or schedule it online, if I had to pick up the phone, I just know myself, I wasn't going to do it. So a lot of that true online scheduling, see real-time availability right up front, no transparent pricing, everything laid out, even for how it works going forward, to me was so important to really put my money where my mouth was. So I want patients to just be able to go to the website, see how the model works, see prices for the evaluation, and then what's all included in the ongoing monthly. And then if it's like what they see, they click schedule now, they see the appointments, they see the availability, probably get in within a week, get sent their invitation to the portal, have a lot of information to complete. I would say it's a gauntlet up front, a lot of capturing history, easy ways for them to send other links to collect collateral information from other people that know them well to simplify the process, a lot of different rating scales, online cognitive testing to gather ahead of time, all the consents. So by the time I meet with them online, it's a full 2-hour eval. I've already gathered and looked through more information than I would have had in a full hour typical evaluation within larger institutions. And I start with that. And that's where I always find it so robust when you get to meet someone already knowing so much about them. So you get to focus on the details and more psychoeducation. So bringing up screen shares and going through everything with them, their rating scales, their testing, bringing up whiteboards and really psychoeducation, drawing things out. What is going on in the brain with ADHD? What are all full menu option of treatments, from medications, therapy, coaching, exercise, diet, supplementation, further labs. I always want to draw and go through that. And that's the whole idea, is just do an evaluation. Then they get to do whatever they want with it. No pressure, but if they want to start up in treatment with it, they can schedule with me, or they can take the report, go to primary care, go to someone in network. But that's the journey the patients have. And then from there, I'm just one step away from their app, from their portal. To me, the patient experience is what it's all about. So I actually use a lot of software that follows more coaching. And I've learned more from coaching and nutritionist software because they have more high touch interactions with their clients. To be HIPAA compliant and all. But I've learned more in that than I have in the traditional health record space, which is more transactional billing related than it is actual connection with the patient provider. So to me, just that I always say message anytime, schedule anytime. I want to help you when you need it, and not just these arbitrary scheduled times, if that makes any sense. And everything's included. So you say binge on me when you need me. Otherwise, I want to be there and available so that you know I'm just one step away anytime going forward.
So very, very patient-centered model. So what does a typical day look like for you in your business at the moment, if there is such a thing? I don't know how much your split is between running the business versus being clinical. It sounds like you're very, very hands-on. What does a typical day look like?
Well, when it started, I started very small, organically, not working with insurance. So I knew it was going to build very slowly. But I did that so I could kind of cross-titrate with other consulting, locums tenens, contracting gigs. And so I had some income coming in while I was starting small. And then as I was growing my practice, I could cut down on the outside gigs. So it let me kind of move. It was during the pandemic where I don't trust a lot of these on-site places. That's why I shifted more towards this. So my day right now, I keep one day. Today's Wednesday. I'm in my office. I see people in person one time. If we start up for treatment to follow a lot of the restrictions with a lot of the medications here. So I see my in-person people, I call it my med startup. We've already evaluated, done everything, come up with a plan. But if they want to start, they meet me in person, get them set up with a blood pressure cuff, and we start from there. So that's on Wednesdays. Otherwise, people just schedule into my calendar. So they see only my available times. Two-way Google Sync with any scheduling is a godsend. So people only see my available times. Doesn't matter what I'm working in. If I have other meetings, a dentist appointment on my personal calendar, everything is synced. So people only see available times. I don't have to manage anything. But it's generally I have it set. I can adjust any hours I want, but I keep it open kind of 9 to 5. Keep a larger lunch break in there. That's what it is. Generally jumping on Zoom between follow-ups. So I can just know when someone's in my waiting room, jump between them seamlessly, easily. But it's different in the model that it is in this kind of per member per month type of thing, where fee for service, you're successful when you're busy, when your calendar's full. That's the epitome of success. For me, I say the better I'm managing my patients, the more stable they are, the more I can manage them, keep up with asynchronous type of work, refills, messaging, things I need to do. Obviously, knowing I have to meet occasionally and gather data, but I want to get it. I'm successful actually when I have a big practice, but my schedule is open, meaning people are taken care of. I can manage them asynchronously during my free time, and it's not just all of those scheduled times. So I have, I'll often have large blocks of time open, and to me, that's a benefit. So yeah, I am not burning the midnight oil. I'm not doing that part. I check in with my virtual assistant in the morning when I start. That was my one hire that I brought on. I always say that to me, it was almost like failure, that if I have to hire someone, it means I'm not using technology as well or as efficiently as I should. I brought her on because, at least here in the States, with a lot of the stimulant shortages, the medication shortages at pharmacies, the nightmare is send a prescription, you do your refills, patients message, oh, they don't have it. What do I do? And we're stuck, and it's just so much extra back and forth. So I did hire a virtual assistant she's part of the messaging thread. Patients don't have to change. They just message one place. And she'll see it, Google map their current pharmacies, start making phone calls to other local ones, find a medication, do all the back end work we have to do so we can hopefully get it, for me, the review and get it resent to a new pharmacy as quickly as possibly and save the patient all that hassle. But I check in with her in the morning, go through things. She's been a godsend in this coming up on probably a year and a half with her as the first and only employee that I've had. Otherwise, I'd say run things very small and lean and use technology to make your life easier.
Yeah, it's very evident from your conversation and using tech. It sounds like a very, very efficient operation. Like you said, very, very lean, very, very efficient. Are you swamped? I mean, certainly in this country, the waiting list in the health service for an ADHD assessment is probably about 2 years. I don't know what the situation is in the US. I guess it's obviously a different healthcare model, but are you not swamped with demand for this? The niching down is your way of sort of controlling your...
Yeah, the niche is there. I haven't really done much in terms of the advertising aspect, but even in the UK, as you're looking, that's within the basically within the insurance model, the time frame. I know here, I don't think it's 2 years, but I know when I was coming into practice where I saw this as a potential niche is it was, at least 6 months, if not more, for a lot of the evaluations. So I saw that was a place for opportunity. And in here, obviously, yes, if as in the UK, you can find evaluations, but if you pay out of pocket, you'll get them much faster.
Yeah.
And that's where this is. Yeah. So am I swamped? I try and keep, once again, I haven't done advertising. I haven't been pushing that. I'm not trying to be busy. I know everyone talks about a clinic and you're successful when you're busy. I want sustainable growth. I don't want even continuous growth. I think I'm around my max number of patients where I just want to maintain where I am. And I am absolutely content and happy with that, which is odd. Everyone thinks grow. I consult other businesses, telemedicine models, and venture capital funded. Everything's about hockey stick growth. That's what scares me, particularly in healthcare, because I don't think that's sustainable. I want a good, sustainable model I'm proud of. And if I maintain that, I don't think the goal is only exponential growth. I think that's a frightening thing, particularly in healthcare.
Interesting.
So I actually think, if anything, I'm going to be trying to tapering myself down until quote unquote retirement.
Sure. From your perspective, what are the major shifts you're seeing in mental health care or sort of telepsychiatry right now? And I guess this is one of the specialities that lends itself very well to telepsychiatry. But as you're in that niche, what are you seeing in the sector?
Well, sadly, it took a pandemic for so many of the leaders in the fields of institutions to finally embrace it. So there's so much pushback against it. Then the pandemic came, and then people were forced to adapt it. And all these heads of places that were actively limiting it and slowing it down. Now they're claiming, oh, look at what we did. We championed this. Look at what our institution did. No, you're the reason it didn't progress. Don't be claiming that you somehow did something great here. But I see even for patients, initially people were more like, still prefer seeing in person. Can I do that? When people are given the option, it's amazing how many people convert ultimately to tele once they realize how much more convenient it is. But in the end, I still think from the provider standpoint or from the patient standpoint, people have different preferences. And the best thing to do is pair people in the way that they want to work together with the providers that want to work in those ways. There's no perfect way for everybody, different conditions, different patients, I think, and providers should have different preferences for how they want to work or to be seen. And I think what we need to be able to do is pair the right provider with the right patient far better than we normally do. As I see people are getting more used to the convenience of, other service. I don't care if it's a haircut or a massage, whatever. I want to see times and schedule them. I don't want to pick up the phone. I want to go back and forth doing all of that. I think people want to be seen sooner, faster, see more transparency, and even with some rules in the US where you have to have costs up front is something that's come up with recent rules. But I think that transparency is becoming more and more apparent in what people are needing and want access to.
Interesting. So how do you think expectations have changed for both practitioners and patients, especially in niche focused practices like yours, because you have a very specific niche, and obviously you've got a fairly lean model, and I think you've tried to make it as frictionless as possible, which I guess is something that appeals to patients. But are there any other sort of things you've noticed in terms of expectations?
Well, I think especially in the patient, another big thing is with health records and patient portals is patients have much more the expectation to be able to message there or some asynchronous way to somehow get some form of help as opposed to schedule an appointment. Anytime you have to get two busy people together, like synchronously at the same time is more complicated. And I always have to ask, are we forcing people to have appointments because it's medically necessary to gather information, make a decision, or is it the only way that you can bill in a typical fee-for-service model? And I think that is something that will start to be changing as we have different ways, even within insurance, different type of appointments, different ways to bill, different asynchronous type of ways to gather data to make decisions. But I think patients have this, I want to be able to message, I want to be able to get a response in a timely way. I want it, if it's reasonable to do it in there, I don't want to have to set up this arbitrary appointment time. And that was a writing on the wall I was seeing 10, 15 years ago, especially when people are booked out so far. you feel like, oh, you have to see me to make a change, but wait, I'm booked out for 3 months. That doesn't help the patient in the middle. And I think we'll start to see more in the moment types of ways to be able to help patients where they are, or that expectation, more immediate answers help, and decoupling the idea that care only happens at scheduled arbitrary times. I think it's not just location independent, but I think asynchronous time independent as well will better fit patient and providers' needs.
Is there anything else that's working really well? I mean, are your patients sort of feeding back that this is exactly what they want? You're getting that kind of feedback, or is there anything else that they really like that really makes your clinic model succeed?
I have, once again, a lot of times when people first with ADHD and adults, they look into it, it's when their children get diagnosed and they start learning about it, like, oh my gosh, this has been me my entire life. And I just did a med cert up here just 20 minutes ago or so. And so woman has 2 kids, seen, treated. The kids are doing well with the medications, but she's realized how much of a struggle it is to find the medications, to get refills from the clinic office, just because there's not organization, they don't have that communication. So every month it's this whole fiasco, not just to find it at pharmacies because of shortage, but even just get the prescription sent and whatnot. And so when she sees this and she knows, she has the app on her phone, she can get directly to me that way. She knows to get in the portal, different ways to check in. She has her blood pressure cuff at home. She has all the data she needs, and she's looking forward to it here. I don't work with kids, so it's not like they just transition. But that's always that feedback where you meet people who have any experience with the healthcare system. The bar is so low. It is so easy to exceed expectations when our own bars are so low. And something I have is, in my model, I always say my goal is, if I can get people back to primary care to take over prescriptions if they're doing well, that's my goal. So I always say, just a message away to cancel services at any time. And I always keep that, no questions asked. Just you let me know, I get it canceled, get your record sent. But I always keep the door open, because it's amazing when people go back to an in-network provider or primary care or whatever, and they realize, wait, it's not as easy as it normally is, where I sent a message to Jake, within 24 hours, he's gotten back to me. He's figured things out. He's fighting with insurance companies. He's making sure I'm getting the cheapest price possible with any savings program that's out there. Like, I'm a bulldog for my patients. Like, to me, that's my passion. But when they go to other places and they're like, okay, yes, it's in network. I'm not paying a monthly fee, but screw this. It's not worth my time. And I just keep the door open so people can come right back. And to me, it's always rewarding when they come back, where they choose, like, this is worth it to stay within the model and to pay it.
Brilliant. Any particular challenges or things that you're finding a struggle from an operational personal balance standpoint? It sounds like you're a very lean operation, but is there anything that's yet to be solved, or things that sort of are an ongoing challenge?
I had to hire my first real employee, because someone has to physically be on the phone with pharmacies trying to track down medications. So the stimulant shortages have been an utter nightmare. A lot of the regulatory things around why I could get into why some medications can have refills and some can't. It doesn't make any sense to me. But the biggest headache, would be managing the insurance and the pharmacy side of things. If you have a prescription on file and pharm techs refuse to look for it and lie to patients and tell them they don't have it on file when clearly it's there for them, it amazes me how much, at least in our country, everything falls back on the patient or the provider. No responsibility or liability from the insurance company that says no or holds things up, or from the pharmacies that don't fulfill kind of what's in front of them. And I think managing those landscapes, those have been the biggest headaches. So checking in the morning with my virtual assistant, saying, okay, did we get anything back? Any fires to put out? And many times it's what pharmacies we have to contact to make sure that they're running a card correctly or using something correctly to get this discount, or, because we have to know how a lot of these pharmaceutical savings programs work. They might be the only medications actually available, and we can potentially get them cheaper with some of these plans. So navigating that and all the back and forth, working with reps, pharmacies, the insurance company itself, and the patient. There's so many cooks in the kitchen where we are that, honestly, those are the biggest difficulties, prior authorizations and whatnot. I would say treating ADHD is easy. Navigating the hoops of getting someone to be able to maintain a treatment plan is, I would say, it used to be maybe 30, 40% of what I do. if it's not 60 to 75% of my day-to-day right now, I'd probably be lying.
Got it. Obviously, you have a lean operation. You're very much in control of everything that's going on. You're using technology. You've got your VA. Are there any particular metrics that you look at to kind of track what you're doing and sort of see how the business is doing, or any indicators that you have?
The thing that I always, so whenever someone schedules, they see the price, they pay. It's Stripe is the back end, and I like a lot of the analytics on there. So especially when I was starting up and growing, would always be following, and I always track. I would even keep basically like a journal, and I still have my old ones going back. I still keep it up. I'd start like a journal entry. I'd say the date, where I'm sitting, so I could bring my mind back if I reread it. And I'd start. I don't care if I get into other more personal things later, but I always start my entry. And it would be the metrics that I was following at the time, or even still now, is what was my last month's kind of gross revenue. And I track this, and it's graphed on a chart. So I see, am I growing from month to month? The MRR, the monthly revenue, whatever the amount of monthly
return, recurring revenue, yeah.
Mm-hmm. Recurring revenue, one of the metrics there on Stripe, and then the total number of active patients that I had. So I'd always get into Stripe, check those, and then I would follow, this is back when Mint was around, now other services, but then just net worth, just overall net worth. Am I moving in the right direction, or am I going in the wrong direction? That's a whole other bit of personal finance, which I always am excited by. And I would track those numbers. And I always told myself, if I'm one to make changes almost too quickly. So I gave myself that, okay, Jack, you don't need to just reinvent everything, or don't get afraid and say it's a failure. Because I've created a model that never existed. I didn't know if this would even work. And I made it, okay, you're not going to make a drastic change unless you see 3 consecutive months of not moving in the right direction. If just because you see 1 month go down, that could be anything. That's not enough data to make a huge pivot on. So that gave me a little bit of grace and a little bit of okay, don't freak out, take a breath. And it's only after 3 months, if I saw a negative trend, that okay, that should be your cue to make a major change. And that was really all that it had come down to. That took a lot of pressure off. And even to be able to look back on these entries and just see that consistent, you'd see it on the graph in Stripe, it's seeing it in your journal entries. That was so helpful. And all your thought process, I always felt like, what are the things I'm building or thinking about or contemplating, and reviewing those. That journey, I think it was so powerful. And looking back in retrospect, I love rereading those entries.
Got it. So where next for Envision ADHD? Where do you want to take the business in the next sort of 6 to 12 months?
Yeah, well, in here, I'm not necessarily in growth mode right now. And it's kind of odd because it's not that I just go and all of a sudden I say I retire and I just end it. I have to get to a point and kind of then let it slowly churn itself out. So I got to think, okay, when is that point where I kind of crescendo and then start decrescendoing? So I'm not trying to go active, grow. Right now I'm just kind of maintaining enough new people to keep up with kind of churn, or people I'm getting back to primary care. But the things I want to get into more is, can I do more asynchronous type of things? Can I build more of a patient journey? I kind of think of it like a sales funnel. More on the marketing side is, can I meet people, 3 type of services, learn about yourself, rating scales, educational programs that they can get in through my EHR. I can build out programs and educational tools, get them into my platform, get them started with it, learn about themselves. Maybe, they can then filter down if they want to take a next, smaller paid type of things, at least get them more and more engaged. Can they order their own labs, get involved in their own supplements, dive further, even types of testing. And then at any point, they can schedule the full evaluation with me. So kind of like a funnel that could lead down, choose your own adventure. You don't have to jump right to a full medical evaluation or medical treatment. That can people learn and start where they want to be in a far less expensive, faster, asynchronous way. But then it's not like they have to start over somewhere, even be able to have that coupon they can immediately apply. So whatever they paid in, they could take off for the assessment. But then they'd be starting up with someone that they're already in my platform. They're in they have their app, they have their portal, and it's just one step away if they want to go the full medical evaluation route. And that type of the educational programming and additional tools that people can use on their own without having to have that. I can't scale myself in my time, but I could certainly scale these other type of of tools and ways of just literally gather information about yourself to learn. Maybe they could take it and use it with another provider, or even to the point that they could have some set protocols, non-medical things that they could even do on their own to lead up to the eval or full treatment, only if they want or need to.
So I guess like a value ladder, starting with an education piece, and then they can work their way up with some sort of online education.
Well, that's something that I could scale as well. So it might be worth putting money into marketing, getting that out there, because people could do it on their own, and it's not just going to fill in a calendar for me, that's not what I'm looking for whatsoever.
Got it. And if there was one major roadblock you could solve tomorrow, what would it be? I think I might know this, but I'm not going to preempt you.
Gosh, I could get into everything here in this country with, I'm not saying like regulation, things are needed, but really just aligning like how, I guess I want patients to be, the whole goal with ADHD, the hardest thing we have is getting our people to be consistent and compliant, i.e. take their treatments regularly, yet we put every roadblock in place to make it impossible for people to take their medications regularly and consistently, which I always find to be rather ironic. But if we could have a way that I can trust that if I send a person, well, actually, something I could get into this all the time. I don't know why a prescription doesn't, if you're my patient, I'm seeing you, why don't I, this is my e-prescribing software, why doesn't it go to you as, I don't know if it's tied to your social security, whatever, to some ID for you. Then whatever pharmacy you go to, you give your information to them, they see it, prescription's tied to you. If you go to this pharmacy, they pull it up. You go to this pharmacy, they pull it up. Why do I have to send it to a pharmacy and it's locked? It's stuck on this one single island, not even a chain of pharmacies, but that particular address it's tied to. And if that isn't in stock or the patient's traveling, they're screwed. Call your doctor. That does not make any sense. Like if I prescribe a med, it's to you as my patient. I don't care where you get it filled. Don't put it back on the clinician to have to reroute it, resend it. And now I have 5 or 6 prescriptions all over town. That doesn't make any sense to me, but that's something I could get into other parts of blockchain and verification of, tokenization of our prescriptions. So we have a full electronic footprint of them all and more secure verification. But those are things I could rant. I get really excited about those type of things. And even here, if I sound upset, it's much more excitement. I always think, what can we do versus just like, I'll adapt to whatever the current environment is. That's what I'm here for. But yes, the trouble with when patients cannot receive their prescription and everything has to fall back on the doctor to fix it or solve it. When in the end is we make decisions. If we send a prescription correctly, that should be the end of it.
Got it. Jake, this has really been fantastic. So I really appreciate your openness, the depth of perspective you brought in this discussion. Thank you very much for joining us. I know you've got a clinic that you've got to head off to shortly, but thank you once again for your time this evening. Really appreciate it. And I'm sure there's going to be something that in what you said that resonates with other practitioners. You have a very interesting model and very interested to learn about it. So thank you again.
Thank you. Pleasure.
Okay.